like it's not going to make me sign in this time. Okay. Hi, everyone. We are well into Unit 4. I hope that you have, or you did enjoy those videos from YouTube. So those are sort of setting the stage and reminding you where the heart is, anatomy, kind of what we're talking about here. Let me find where I'm supposed to be. Here we are. Okay. So this module and lecture will be discussing blood and blood flow, and in particular, cardiac output, which is just really an important concept for us to understand in exercise physiology. So we did the overview of heart anatomy. You did those in the YouTube videos that you just watched. I need some caffeine in my life today. Okay, we have our 4 chambers, we have our vessels, we have our valves, and the heart contains all of these main components. And what I hope you appreciate, and what I want to remind you is just how amazing our heart and our lung and our muscles and really just the way that the human body works. It's just absolutely phenomenal. So let's go ahead and get in to some of these really cool physiological terms. So cardiac output, our equation for cardiac output, we usually discuss cardiac output in liters per minute. So cardiac output is heart rate times stroke volume. So cardiac output in sort of a definition will be the amount of blood pumped by the heart per minute. And cardiac output is influenced by 2 major things: heart rate. So this will be the number of beats per minute, and stroke volume, which will be the amount of blood pumped per beat. Okay, so maybe this was a review, maybe it's not, but we really need to be on the same page with what cardiac output is and then what factors influence cardiac output. So this really is going to be what this lecture is about today. So in breaking down these terms, we know that cardiac output is heart rate times stroke volume. So cardiac output is also sometimes known as Q for the quantity of blood or the amount of blood pumped by the heart over 1 minute. Now, maximal cardiac output, and we'll talk about this when we talk about exercise here at the end, this really is going to reflect the capacity of your central nervous system. So next we must talk about end diastolic volume and end systolic volume. So end diastolic volume is going to be the amount of blood in the heart's left ventricle just before the heart contracts. So this is also known as preload. So the amount of blood in the veins before the return to the heart before contraction. And there is another equation for stroke volume, which is known as end diastolic volume minus end systolic volume. So therefore, we have 2 factors that affect stroke volume: end diastolic volume and end systolic volume. Usually, stroke volume at rest in a normal, healthy individual is about 70 mils per beat. We also know that stroke volume is end diastolic volume minus end systolic volume. And to put some numbers to this, end diastolic volume usually is an average of about 120 milliliters, while end systolic volume is usually around 50 mils. And that's how we get our 70 mils for our stroke volume at rest. 120 minus 50. That's right. There's also another important term called ejection. Why does it sometimes erase? Ejection fraction. And essentially what ejection fraction is telling us is how well the heart is pumping. And ejection fraction really is used for a marker of heart failure. And heart failure is a disease sort of over a long-term progressive state. So heart failure doesn't just happen overnight like a heart attack might. Heart failure really is kind of a long, slow, very debilitating progressive disease. So heart failure does not occur suddenly. So for ejection fraction, usually 50% to 70% ejection fraction is considered normal. So how well the heart is pumping. So we also talked about how important heart rate was in the overall equation of cardiac output. And so in discussing the regulation of heart rate, this comes from two effects. We have parasympathetic effect, and we also have sympathetic effect. So typically what happens in a young, healthy person is your SA node, without any sympathetic or parasympathetic innervation, will keep your heartbeat at 100 beats per minute. So the SA node ticks at 100 beats per minute. So typically we would like to see our resting heart rate be less than 100. And in a young, healthy person, this is the case. So to have a resting heart rate less than 100 beats per minute, we need to have some sort of parasympathetic effect. And this parasympathetic effect is what will keep heart rate down. And it will keep heart rate down in about the 60 to 70 beats per minute. So that's important to remember, is that the parasympathetic effect is what will keep the heart rate down below that 100 beats, which is what it naturally wants to be beating at from your SA node. So the parasympathetic effect will keep your heart rate down to about 60 to 70 beats per minute. So if we have an increase in heart rate, from resting, that means, wow, I think it's because my pinky touches the screen and then it erases. An increase in heart rate from resting, try to hold my pen up here. We will have a parasympathetic tone that is withdrawn. being taken away until 100 beats per minute. Then norepinephrine is released by our sympathetic nerves, and therefore your heart rate will increase. So we know that the regulation of heart rate is influenced by parasympathetic and sympathetic effect. The parasympathetic effect keeps the heart rate down below that 100 beats per minute, around that 60 to 70 beat per minute mark. So if we have an increase in heart rate from resting, that means that our parasympathetic tone is being withdrawn. It's being taken away because norepinephrine is released by sympathetic nerves that will cause heart rate to increase. And again, here is just sort of a summary of that, discussing the regulation of heart rate and the sympathetic and parasympathetic control of this heart rate. So it says a normal heartbeat is maintained by a slow, continuous discharge from sympathetic nerves, and then the vagal fibers are distributed mainly to the atria, then the ventricles. So here's a visual of what is going on with our sympathetic chains in our heart to regulate heart rate. Now let's talk a little bit about the regulation of stroke volume. So we know that stroke volume is the quantity of blood ejected with each heartbeat. And we have sympathetic effects. So norepinephrine is released by sympathetic nerves that increase with the force with ventricular muscle fibers contract. So this can be done because of our increase in calcium storage. So norepinephrine is released by our sympathetic nerves that increase with the force when the ventricle muscle fibers contract. And that will also cause an increase in our calcium storage release that's mainly present when we are talking about the effects of exercise. So now let's go ahead and look at a nice table here for typical values for our stroke volume, our heart rate, and our cardiac output. So we know that heart rate times stroke volume equals Q, which is also our cardiac output. Remember, and if I haven't said this, that 5 liters is a typical cardiac output at rest. And this happens to just be, for this example, in an untrained male. You can see that an untrained female has a cardiac output of about 4.5. Oh, look, a trained male and an untrained male, the same. What's different, though, is how we get to that. Our heart rate times our stroke volume. So in an untrained male, we have a heart rate of 72 times a stroke volume of 70, whereas in a trained male, we have a lower resting heart rate. That is true. Whenever we are a trained individual, we have a lower resting heart rate. And look, we have greater capacity for stroke volume. So that's why those two numbers are the same, but the heart rate and the stroke volume that we use to get to that cardiac output is different. So really cool physiological mechanisms going on there. And then you can go ahead and look at some of these maximal cardiac output values. So these up here are at rest, and these down here will be at exercise. And don't you worry, we're going to draw out a graph to hopefully visually help make this make sense. So another important concept to talk about is the effect of muscle contraction on stroke volume. So muscle pumps. This is a really cool physiological concept and mechanism. So muscle pumping is going to be the contraction of your calf muscle. And essentially what your calf muscle does is it is squeezing and forcing blood back to the heart. So this is your lower half of your leg. So this is your calf muscle. So like right above your ankle, we demonstrate calf muscle. I'm getting crazy towards the end of this class. So muscle pumping, contraction of calf muscle, squeezing and forcing blood back to the heart. So as you begin walking, you are going to have an increase in your end diastolic volume, which will directly influence stroke volume, causing stroke volume to increase. So skeletal muscle, that's what SM stands for, have auxiliary, AUX, 1L, 2Ls, that's okay. Auxiliary pumps that basically squeeze this blood back to central veins. So remember the skeletal muscle pump, the contraction of the calf muscle, squeezing and forcing blood back up to the heart, which directly influences stroke volume. So in talking about factors that affect cardiac output, we know again that cardiac output is our heart rate times stroke volume. So let's talk about factors affecting heart rate. What are some factors that affect heart rate? Hormones, autonomic innervation, age. So the older you get, your resting heart rate will increase and your maximum heart rate will decrease. Some other factors that affect heart rate, if you're sick, if you have a fever, I can always tell if I'm feeling a little bit under the weather by my wonderful Garmin watch. It gives you, your resting heart rate, and there's a lot more fancier versions than the one I have that will really track over time. And you can kind of see, oh, that's the day I kind of had that scratch in my throat, right? So fever affects it, stress. Oh boy, does stress affect heart rate. Drugs, say no to drugs. And so fitness level will also affect your heart rate. So you will have a lower resting heart rate the more fit you are. And that was evident by this example that I showed here for our untrained male at 72 beats per minute, and then our trained male at 50 beats per minute. Okay, now let's discuss some factors affecting stroke volume. Much of them will be the same. Fitness level, preload, afterload, gender, heart size, and blood pressure, just to name some of the few that affect cardiac output. Okay, yay. Graphs, I get so excited. So let's go ahead and break these down a little bit. So in talking about cardiac output, we know that we mean the quantity or the amount of blood being pumped by the heart during a 1 minute period. So the maximal value is going to reflect the functional capacity of the cardiovascular system. So what I want to do is zoom in here on the right. So this is a very simple bar graph showing cardiac output, which we know is measured in liters per minute. And we know that at rest, for males and females, trained and untrained, this will be our, yeah, we can kind of group it together. Trained or untrained, we will have a resting cardiac output of 5 liters per minute. Now, as we talk about maximal exercise, you can see in the green bar for our untrained individual, they will have a maximal cardiac output of about 20. If you are a trained individual, you will have a maximal cardiac output of about 30. So you will see an increase in cardiac output the more trained you are, as detected by a maximal exercise test, like our VO2 max test that we've discussed several times throughout this class. So make sure you are familiar with normal values for cardiac output at rest, untrained, and trained. I won't get into specific differences of males and females. We'll just kind of average them, knowing that they're not the same, but generally speaking, they are. So here are factors that affect cardiac output. These are the same things that we denoted up here. So if this is a little bit cleaner and a little bit easier for you to read, definitely use this to refer back to. So the slide that I want to end on, and oh boy, is this a very, very, very big and important slide. So I don't want to jip us. I really want to take some time to understand this. And so this is the moneymaker. This is the really cool part. So let's go ahead and orient ourselves to the graph. Down here on the x-axis, we have liters per minute. Cardiac output gets up to 30. Hey, look, we just saw that a trained individual can get their cardiac output up to 30 liters per minute. Okay, so this tracks. Now, on the left-hand side, we have stroke volume. Remember, at rest, we have said that stroke volume is around 70 milliliters. Obviously, this graph is talking about exercise, so we're going to be at values above resting levels. If you look at the left-hand, right-hand side, this is heart rate. Hey, look how cool this is. We know that maximal heart rate is 220 minus age. So we must be talking about a 20-year-old in this graph who has a max heart rate of 200. Okay, so we have all the factors in play when talking about cardiac output. Stroke volume times heart rate equals cardiac output. Now, simple graph, but the concepts of how we get here are a little bit more difficult to understand. So if you look at the stroke volume that is in pink, let's go ahead and just read up here. Maximal exercise capacity is roughly 30 liters per minute. There you go. Stroke volume, this is the moneymaker. This is important. Stroke volume increases until roughly half. Okay, 15 is half of 30, until roughly half of maximal cardiac output is achieved. Therefore, further increases in cardiac output are going to depend strictly on heart rate, which increases as you go through a maximal exercise test. So make sure, if you don't remember anything from Unit 4, except for one thing, it's this phrase right here, that maximal exercise capacity is roughly 30 liters per minute. Stroke volume increases until half, when it then plateaus. So any further increases in stroke volume are going to depend solely on the increase in heart rate. We did it. Okay, see you for the next one.